Hi, everybody. Good morning or afternoon, depending on where you are joining us today. My name is Matt, and I want to say thank you so much for joining us today. We really value your time, and we've got a quick, and a short but very important webinar for you today on the new CMS authorities, and we're happy to share that. So just want to say thanks, thanks for joining us today, and thanks for signing up and choosing to spend these 30 minutes with us. A little bit about today's presenters. You may recognize if you've been to a Provider Trust webinar before, but this is Mike Rosen, our co-founder on the left, who has 30+ years experience in the background screening industry, started Provider Trust about 10 years ago, and has worked on the ongoing credentialing monitoring side of healthcare since then. So that's a little bit about Mike. And Donna Thiel is our Chief Compliance Officer. Donna comes from plenty of years of experience as a compliance officer, and really brings that that industry knowledge that we don't have anywhere else from provider trust. She is our source of knowledge when it comes to compliance. So that's a little bit about your presenters today, and today we will be covering the expanded CMS authorities and what that means for providers and payers. So before we start, just a little bit about us. We are a software as a service company here in Nashville, and we work with hospitals and long-term care facilities, health plans, and all sorts of other organizations across the nation to streamline their workflows and make their work lives easier. So we're passionate about that. We do believe that a smarter healthcare makes a safer healthcare, and we live this out by monitoring your healthcare populations to identify compliance and credential issues before they impact patients. And if you have any questions about anything that Provider Trust may do, we are happy to talk to you about that at any time. I do want to take this time to tell you guys that you will receive a copy of the slides as well as a recording of this webinar after the presentation, so this afternoon, and so be on the lookout for that. This webinar is also currently pending approval from the Compliance Certification Board for CEUs. That will be 30 minutes of CEUs, which is about 0.6. So be on the lookout for that as well, which will come later on down the line. We are happy to offer educational resources for compliance and HR professionals. We know that it's important for us at Provider Trust. It's actually a company value to help others grow and succeed. And we like to do that by providing these helpful resources. We just got a new site about a month ago, and we have over 300 resources for you guys to check out and find whatever may be most valuable to you and to share with your team. So just thanks for being here. We're excited to learn together and grow together with you guys. A little bit about our upcoming webinars through the rest of the year. We will have a webinar. Our next one is November 13th on leveraging exclusion monitoring to protect provider networks and control recoupment costs. We're really excited about that one. And then again, you'll get a copy of these slides so you guys can check it out after or when you're able to review them later on. But this is what's coming up from Provider Trust, and we hope to see you guys there. So a little bit about our agenda. We'll start off with the new CMS Final Rule and all about that, and then we'll go into a phased-in approach, and then how this may affect your organization and how to kind of react to that. And then finally, we'll go over the key takeaways and how to prepare. So with that, I will hand it over to Donna to kick us off on the new CMS Final Rule.
Thanks, Matt, and good afternoon, everyone. As Matt said, we're always so appreciative to have all of you joining us. So Mike and I are going to cover as much as we can about this new CMS rule. As Mike and I will share as we go through this presentation this afternoon, we only know as much as has been published up until this date, and we're doing our very best to analyze the rule and to provide some feedback and information, recognizing that there's a lot more to come as CMS decides how to implement some of these particular requirements. So keep that in mind as we move forward today. So let's get started. So what is CMS trying to actually solve? Well, CMS has told us and their quote is, strengthens the agency's ability to stop fraud before it happens by keeping unscrupulous providers out of our federal health insurance programs. I think we would all agree that at any point in time, whether it's CMS, the Department of Justice, the OIG, all of the governing bodies are certainly trying to assist us in preventing fraud before it happens. So let's look at their perspective from several years ago. Back in 2016, there was a report that was entitled The Medicare Vulnerabilities Related to Provider Enrollment and Ownership Disclosure. And you can certainly read this quote for yourself, and many of you have probably already seen this quote from Seema Berman. But she talks about how expensive and inefficient the process is today and describes it as a whack-a-mole process. And I think that's just a great visual for all of us who are old enough to have been to carnivals and things, right, where that game was there and you're just constantly whacking that mole that's popping up through all those different holes. And I think they're looking at it, and I think we see it too, as whenever they implement a particular program, you know, that they feel is controlling or reducing the fraud, people just figure out how to reemerge or re-engineer another scheme. And so constantly just in a whack-a-mole process. So certainly this new regulation is trying to be more proactive and requiring additional information through the enrollment process and re-enrollment process, and trying to just get their head around it. So back in 2016, they were already looking at how to improve this process. So what are some of these new requirements? So the provider enrollment standards, you know, this is specifically focused on program integrity enhancements to the provider enrollment process. So the new items that they're going to be at, and quite honestly, we know that the implementation date is November, but in fairness, many of these things that we're going to talk about are going to be implemented at some point in time, that point in time TBD. So those new items give enforcement authorities the opportunity to reduce criminal behavior in Medicare, Medicaid, and CHIP. And again, it's important to note here, it talks about Medicare, Medicaid, and CHIP, and most of the specific language seems to speak more to Medicare, and then has a component in the rule that does say that the state Medicaid programs have to also implement requirements. So we're not really sure exactly where the state agencies are going to be in this process. And know that as you see these slides, they do mostly refer to Medicare because that's what's in the final rule, but we know that this will eventually apply to Medicaid as well. The next area is revocation and denial authority to try to stop, again, that fraud, waste, and abuse, really giving them maybe a stronger stick, if you will, relative to the denial opportunity. Affiliations, we're going to talk about that in just a few minutes. A new defined term, so affiliation authority, giving CMS the opportunity to identify individuals or organizations that pose a risk, and relationships with previously sanctioned entities. And we're going to talk about the challenges of that and what that means. And then certainly expanding Medicare, Medicaid, and CHIP enrollment reporting requirements, which is the bulk of what we're going to talk about. So what is CMS trying to solve? I think we just talked about, right, kind of that whack-a-mole, or what people often say, you know, chase and pay, right? So we get paid and then they're chasing, trying to get those money back. And we know that whether it's CMS or, you know, all of the entities really are just sick and tired, if you will, of paying the money and then trying to recoup it back. Really looking at bad actors, where are they and how are they flying under the radar at this point? What are the schemes that are out there? Recognizing that self-disclosure doesn't always work, right? Certainly bad actors probably are not reporting on themselves. We know, right, that there are billions of dollars spent every year on the prevention of fraud and abuse, or the oversight or that chase process. They're certainly trying to look at enrollment disclosure not as a last step anymore. We talked about that affiliated entity and trying to understand what the schemes are and what's happening, and getting more information during enrollment. And certainly we're not catching all the bad actors, so trying to think of new ways to find that. So what are we worried about as providers as we're looking at this new regulation? So providers now have a concern about enrollment revocations, right? CMS now has greater authority to revoke a provider's Medicare enrollment. So certainly something that we're always going to be worried about, right? That CMS would revoke our ability to bill Medicaid or participate in Medicare. Unnecessary oversight, more work created, burden of collecting and evaluating so much affiliate information. We're going to talk about what all those requirements are and thinking about it from a provider perspective. How am I possibly going to collect all this information? And knowing that the new guideline goes into effect in November, kind of a short timeline. So let's talk about what that timeline is. So the rule was published on September 10th, obviously of this year. There's a 60-day comment period. So the effective date of this rule is November 4th, 2019. So comments are being accepted right now, but they've already published the final rule and have an effective date. Now, they have come back and stated that this is going to have a phased in approach. So we know that November 4th is the date, but it's not really touching us, if you will, exactly on November 4th. So Mike, do you want to take us through some more of these specific requirements?
Sure, thanks, Donna. You know, when Donna and I were reading this, as I'm sure you have when you first saw it, it kind of seems like CMS is mad at the provider world and the health plan world, because they kind of assumed we were all going to be doing our jobs in being honest and fair, in disclosing information, self-disclosing, putting proper information in enrollment forms, and yet they're still having to chase down fraud. So whether or not that's the case, they're really putting their foot down with regard to the ability now to revoke enrollments that they've already enrolled once they find out information may not have been truthful, or that there were past affiliations of those providers with bad actors. And so that's what this is really talking about. So their affiliation authority, that's a new term, and it's one that CMS has sort of penned here in this final rule. It affects providers and suppliers, and I think you'll be surprised by the definition of supplier as it pertains to this rule, which we'll show in a minute. But talking about even relationships with a previous sanctioned or revoked individual or entity is where they're drilling down and have never drilled that far before. This also applies to reassignment relationships, and we're not sure what that means. We couldn't really find much help in that regard. So that's an area I believe we'll all be seeking more comment and looking for directive from CMS shortly. But certainly ownership interest is going to become something you're going to have to sort of figure out and find out. So let's start with who is an affiliate by definition under this new rule. An affiliate must meet these parameters with regard to being a provider or a supplier. That person or entity has to have 5% or greater direct or indirect ownership interest. There's some carve-outs whether or not it's public or not. It affects general and limited partnership interests. It has an interest in any individual or entity that exercises operational or managerial control. If you think about that one, it's very similar to how the OIG has enforced exclusions against an excluded provider that says, wait a minute, I'm not actually involved in the company. I simply own the company, or I'm not directly or indirectly managing it, when in fact they are. They're reviewing billing, they're making decisions. And so this is another chance for them to go after those kinds of things that have a direct or indirect conduct on the operations. In number 4, if there's an interest in which the individual is acting as an officer or a director, that is also problematic if they are in fact on several of the lists that we'll show you in a minute, you need to be aware of. And then again, a little bit more on the reassignment relationship, which we weren't yet able to fully comprehend, but there is a site to the federal code there if you want to try to. So who's a supplier? When you think of supplier, Don and I instantly thought, oh, okay, vendors and entities. It's actually defined in the Code of Federal Regulations, meaning a physician or other practitioner or an entity, which could be a company, other than a provider that furnishes health care services under Medicare. So we think of that as the speech pathologist that comes on site or some type of contract practitioner. They're a supplier in the eyes of CMS as far as this rule applies. So the provider and supplier disclosure, now they're putting the onus on you to disclose certain things that otherwise they were assuming were going to be put down in the enrollment form 855, but really isn't coming to them that way. So CMS now, or as of November 4th, will have the authority to identify individuals and organizations with an undue risk of fraud, waste, and abuse, and then they're going to block them from getting enrolled for up to 10 years. And that's an expanded amount of time frame for anything that they've otherwise had in the past. They're really serious about keeping actors out before they can commit the crime or the fraud, rather than try to chase it and whack-a-mole, like Donna mentioned. Previously, revoked providers were able to re-enroll after 3 years. Now it's going to be a 10-year bar. So they're getting serious and putting down the gauntlet here. So what is a disclosable event? And that's a defined term under the rule. And for an affiliation under the rule, it must, that would be a provider like yourself on this call, must disclose if it is a provider or supplier that meets one or more of the following event or items. Now, what's interesting, and we'll go through these, some of these, there are no public record source for you to search. So I'm not sure exactly how you're going to do this, or any third party to try to help you, because there's not this database of information available. Number one being one of them. Either you're going to have to know, ask, or figure out whether that affiliated individual or provider or supplier currently has uncollected debt to Medicare, Medicaid, or CHIP. I'm not sure where that information would be housed or how you would know that, but that is whether at the moment of doing business with them, they are currently in that situation. Number two, if they have been or they're subject to a payment suspension under a federal healthcare program for which there doesn't appear to be a public-facing database to see, that is something you're otherwise going to be held responsible for knowing. And the news gets a little bit worse because you have to know this back in time by 5 years of having done business with them. And number three, you should all be doing today, and that is checking for exclusions at the federal and the state level. That is public, it has been, that's an easy one. That one you can rest easy, you can be doing or should be third-party outsourcing. Number four, a disclosable event would be if that provider or supplier has had their Medicare, Medicaid, or CHIP billing privileges denied, revoked, or terminated. Again, not sure that that's available publicly for you to search. So how to meet that is going to be something I think they're going to get a lot of comments and questions on. As we mentioned for disclosable events, the timing is irrelevant except for a current uncollected debt. So you have to know both if it's a current uncollected debt for number one. If, in other words, if the enrolled or enrolling provider or supplier had an affiliation with provider in the past 5 years, and at any point prior to or after the termination of the affiliation, they had a payment suspension or exclusion or denial, revocation, or termination, that's something that you're going to have to disclose. So you got to know now, and you got to know 5 years ago what that affiliated party was doing. So we're going to talk about, as Donna mentioned, the phased-in approach of this, and it is, quote, phased in. It's a very short phase. 60 days is the shortest I can recall, from publishing to, and technically it's not even 60. If you go from September to November 10th to November 4th, it's shy of that. But what's going to happen, and the way you as providers are going to find out that you're on their radar screen, them being CMS, is they will contact you if they think, based on whatever data they're pulling, my guess would be it would be on previously billed and other information on 855 forms. They'll contact you to find out some information they're expecting you to know. If CMS determines that in their mind a provider or supplier that you're doing business or had done business with had at least one affiliation that includes any of those discoverable events: excluded, uncollected debt, billing privileges revoked, etc. Now, they may have more information at their fingertips than you, and you'll find out. Any of you have been contacted or wish to disclose that you have, we would love to find out more information and pass on to other colleagues without, notifying that it's you, what your experience has been. My guess is that we're gonna see some hands raised after November 4th, and we're all gonna learn from that first batch that they're gonna phase in. The phased-in approach, we do want to note that many components of this new rule are currently incomplete for providers, and finding that information is going to be hard. So as we mentioned, CMS still has to revise Form 855. That's something they promised they would do, and I believe is contingent upon before they can really come after anyone. So whether that is done before November 4th remains to be seen. But be looking for a new CMS 855 form and what things you're going to have to be better at collecting and disclosing. During that initial phase, they will only be requiring providers and suppliers to disclose affiliations if CMS determines that provider had at least one affiliation in any of those 4 disclosable events. And they will specifically request the provider or supplier to submit that information. Now that's going to come to you. Like most likely, you're going to have to prove what you have in your files on those due diligence of those affiliated providers. So there is an expansion of the disclosure requirements, and we're going to talk a little bit more about that in detail shortly. Now, again, here we recognize there's not really the public database of information, certainly on Medicare payment or suspensions, that we can find on the web. And if you do and would like to disclose or share it, please do. Your colleagues would be eager to see it, but it doesn't seem to be there. And this causes some major concerns for enrollees to address. So CMS is considering a new or should have reasonably known standard like they do for excluded individuals. So look for that to be potentially the standard. The true test obviously still remains. Which providers will CMS select and which ones will they test first? Don't know. You can let us know as you are contacted, but they must report all those affiliations and have some processes in place to capture information. What they're going to be looking for is proof of exclusion monitoring that you should be able to easily show quickly, and that should be done on a monthly basis from their perspective. Affiliate and owner information is something you're going to need to start collecting if you haven't, better if you have, with regard to those affiliates. And whether or not you can find or are aware or asked on the form of any previous suspensions, any uncollected debt that's current, or any other privileges that may have been denied or revoked. So what does exist as far as availability are the exclusion sites listed below. What is not apparent or doesn't appear to be easily found are the other 3 that they're going to be looking for you. So Donna, why don't we talk a little bit about how we think this affects an organization, those providers and listeners today.
Thanks, Mike. So let's talk. So now we're going to talk again about the components within the new rule. So we know that CMS has increased authority to revoke or deny. So let's just talk about the what if at some point in time when we get all those other things that Mike was just talking about squared away and CMS has figured out a way to collect all that information and hold all of us as providers accountable. So CMS may deny or revoke enrollment if these particular components happen. So if a provider fails to fully or completely disclose affiliations that they have or have had a disclosable event, if CMS determines that any of the disclosed affiliations pose an undue risk, right? Again, this is their interpretation of undue risk of fraud, waste, and abuse. So they're saying that because of the affiliation that you have with a particular provider or supplier, you now have risk of fraud, waste, and abuse. So it's a connection that they're drawing based on the information of the relationship between the provider and the supplier or / affiliation. A provider or supplier circumvents program rules by coming back into the program. So we talk about this a lot at Provider Trust when we talk about piercing the corporate veil and looking at I was excluded at, as a provider of this type, and so then I start up a new pharmacy and I manage the pharmacy, but I don't really use my pharmacist license anymore. So this is really saying that I got in trouble for a particular reason, and now I'm trying to get back into the program and bill for items and services with a new alias, if you will. So we know that today that's already something that they're certainly watching for. A provider or supplier bills for services or items from non-compliant locations. So these are terms that we're going to watch, I think, as CMS gives us additional information for what a non-compliant location means. In my mind, that's a non-compliant location as it relates to completing all these additional pieces of information that this new rule requires. Certainly a provider or supplier exhibiting a pattern or practice of abusive ordering or certifying of Medicare Part A or Part B services. And then a provider or supplier has an outstanding debt to CMS from an overpayment that was referred to the Treasury Department. So we've identified an overpayment, we've failed to pay it back. That now falls under the CMS authority to revoke or to deny our enrollment. So what are those evaluation criteria or factors that CMS is going to be looking at? They're going to look at the duration and the extent or the relationship of that affiliation. They're going to look at whether that affiliation is still in existence or whether you've ended that affiliation. Why did we terminate the relationship with the affiliate? What type of disclosable event occurred and whether that disclosable event happened during the time of the affiliation. Makes sense, right? So if I have an affiliation at the same time that this disclosable event happened, probably my risk is greater than if this was something that the affiliate did 5 years ago and now I have a new relationship with this affiliate. And really, let's hope that they're good standing providers now, and so it's really hopefully no harm, no foul. In the case of the uncollected debt, what steps have been taken towards repayment? In the case of denials or revocations, what was the reason again? What's the reason behind that action? And then, of course, the last one we always like, right? Any other evidence that CMS thinks is relevant. I think we all feel like we've ever been in a government investigation. They have information that none of the rest of us have access to, and they certainly consider those additional pieces of information into their final decision making. So, and as Mike has already talked about, right, we really don't know how we're going to capture those quote disclosable event pieces of information. I think this is an area where we all know it's a TBD, and as you're looking at how is this going to impact my organization, I think unfortunately it's a wait and see, wait until CMS gives us some additional direction on these pieces of information.
On their own website, which is the screen capture here, they don't even give you a link to get that. And this is on CMS's website.
Yep, good point. So compliance standards for vendors, owners, and third parties. So as we're kind of thinking about what is it that we're doing, we know that risk management remains critical, right? So as we're looking at those affiliates, really trying to understand who's who, we know that the provider bears that burden of responsibility for smarter and more effective affiliate screening and monitoring. We talked about the definition of a supplier relative to this rule. We know that as we partner with just vendors and other third parties, it is the responsibility, or that burden falls on the provider to make sure that they're making good decisions on those partnerships. Data management and a process for collecting and interpreting all this disparate data is absolutely a challenge. Clearly with this rule, we don't even know how to get the data, let alone know how to process it or interpret it. Many partners or many providers and organizations are partnering with data companies to try to fill in those gaps because we know right now that the government sources and databases, they may not be inefficient or unreliable. They may just simply be unaccessible. So I think our responsibility as providers is it's harder and harder to manage those relationships, but I think the burden is very high that we understand who we're partnering with at any point in time. So when you're onboarding and monitoring, I think we recognize that we don't necessarily have the tools and the number of resources that we need to really understand the ownership of those affiliations, and trying to figure out how we're going to get to that piece of information is a challenge for us. We we know that it's difficult at times to get accurate data and timely updates to the systems and the pieces of information from our vendor partners or from our suppliers. And we're being held more accountable over and over about documenting our compliance and standards and activities. The last thing I want to cover before we talk about our key takeaways and how to prepare is just that we're focused today on CMS and what's happening on this particular rule and their goal of, getting rid of the whack-a-mole and reducing fraud, waste, and abuse. And just wanted to highlight just a couple areas and provide you with some links of some really recent DOJ and OIG specific takedowns or settlements that we've seen. And these are just a few, and there'll be links in the slideshow that Matt shares with you later today. If you haven't read these, there's some really interesting stories that are that have happened just within the last month or so. So I'm going to turn it back over to Mike, and he's going to wrap us up today with some key takeaways and some thoughts on things that you all can do right now while we wait for some additional guidance from CMS.
Sure. Well, obviously there's going to be a lot to follow, and we will be doing our best to keep you informed, whether that's through blogging or informational emails and things that we want to keep you apprised. At this point, we do know what's unknown, and that is who are they going to pick and how are they going to pick those phase 1 test cases. That just isn't defined, and we'll see how quick out of the chute they're doing that after November 4th. How will providers be able to go back 5 years? I mean, you weren't aware you had to do this until a few weeks ago, and now you are scrambling to have to figure out if they come knocking, how are you going to document what you've done for the past 5 years? On number 3, how and where can a provider go to search for these databases that don't exist necessarily publicly remains to be seen. And I think I would look for the comments that come back from CMS, hopefully before November 4th, as to guiding all of us what they're going to hold over your heads. The rule clearly applies, as Donna mentioned, to Medicare enrollment. But how and when and which state Medicaid enrollments will follow and adopt the final rule, that obviously will take some time. So I would think that I would focus my energies on Medicare concerns after November 4th and see how your state Medicaid does with adopting this rule and providing some guidance on how they will separately enforce that if they do. And then when is this new form coming out? What's going to be different about it? There's no it's not like Apple where you have all these bloggers trying to figure out what's coming in the new iPhone. Nobody really knows what the new 855 is going to look like. My guess in Donna's, when we talked about it, is it's going to have more information on who owns more than 5% of the company, what other businesses have they been associated with, things that will help them and you prepare for meeting this rule going forward. What can you do right now? That's a great question. Keep your eye out. There's some great resources. We're going to provide you links to some law firm blogs that we found very helpful and instructional. And as we get more, we'll post them. We suggest you read them or have your counsel help advise you on what they mean. Keep monitoring those affiliates that you can. I would think you would want to know who are the owners of those businesses. You're hopefully already collecting that, but certainly monitoring them for exclusions as the lowest bar to start the process. And make sure you have an understanding of those organizational structures, ownership. Ask questions when enrolling your vendors that you can have that information already at hand. You also need to probably communicate with those affiliates that you're going to need some more information from them because the onus is going to fall on you if CMS comes knocking. Be sure you are honest, complete, and accurate on your 855 form. Obviously, I think that's where CMS is going to start finding the first phases is which ones they think are lying to them. So I'd retrain people on that and make sure that things are purposely left blank that would trigger their need to come look at you. And as for payers, ask providers during enrollment whether they've been contacted by CMS about this rule, and if so, what, if anything, have they been given or provided? I think sharing of information is fair for all of us in this regard. The takeaways we would like to leave you with: CMS intends to remove bad actors before they enroll and less so having to revoke them later. So they're stepping up the game. This phased-in approach is their attempt to do so in fairness. It's a very quick phase, so I don't know how fair that truly is. CMS has increased the focus on affiliates and owners because they're already finding fraud amongst the obvious first level, and those are the providers through the enrollment. And providers must document all this information, keep it, and you're going to start needing to build that 5-year look back if you haven't already. Certain data is not available, we've covered that, and they now have more authority to deny what's something they've already put out there. Here are the resources we're going to leave for you. They're all hypertext links, and you're welcome to go through and find them. And we hope that this covers as best we could what information we know about this new rule.
And I think, Mike, we might want to just point out, we also added an appendix.
Yes.
Because we wanted to keep our session today as brief and efficient as possible. There's some additional slides that we had that we thought would be important as an appendix, but certainly not ones that we needed to cover today. So they're at the end of the presentation that Matt will share with you later today.
Great, thanks Mike and Donna, and thank you all for choosing to spend your time with Provider Trust today. I really appreciate it. Again, be on the lookout this afternoon for a copy of your slides and the recording, and then your CEU certificate down the road. So from us at Provider Trust, thanks again, and I hope you have a great rest of the week.